Cardiovascular system. Cardiovascular system consists of, or it describes about the structure of the heart as well as the blood vessels associated with it. Heart is a hollow muscular organ which is present in the middle mediastinum. Mediastinum is a space which is present between the two lungs. This mediastinum has two subdivisions, a superior mediastinum and an inferior mediastinum. Superior mediastinum is a part extending from the thoracic inlet till the sternal angle that lies at the level of fourth thoracic vertebra. You can see the thoracic vertebrae here and in front the sternum. Sternal angle lies between the manubrium sternae and the body of the sternum. This junction denotes the sternal angle which lies opposite to the T4 vertebra. So up to this level is the superior mediastinum, and below this level is the inferior mediastinum, which is limited in the lower part by the diaphragm. The inferior mediastinum is again divided into an anterior mediastinum, middle mediastinum and posterior mediastinum. Anterior mediastinum is a narrow space which is present between sternum and the heart. Middle mediastinum is a space where heart locates. Posterior mediastinum is a space between heart and the vertebral bodies. So this is a posterior mediastinum. So to be exact, the heart is situated in the middle mediastinum. It is covered by a pericardium, which is a protective cover for the heart, and it measures about 12 into 9 centimeter. 12 centimeter is the length and 9 centimeter is the width. It weighs about 300 grams in male and 250 grams in female. Regarding its external features, it has an apex, base, 4 borders, 3 surfaces. In this picture, it is very clear that the anterior surface or the sternocostal surface of the heart presents only the right atrium and a pinna-shaped extension from the right atrium called right auricle. Left atrium is not visible from here, but left auricle is there. Right ventricle, left ventricle are visible. So the only chamber which is not visible from the anterior aspect is the left atrium that forms the base of the heart. Apex is the pointed part of the heart which is formed by the left ventricle. That's a maximum pointed area of the heart which is formed by the left ventricle. So that is about the base and apex. Then the borders. It has a superior border formed by 2 atrium, right border formed by right atrium, then inferior border which is formed by right and left ventricle and a small portion of the left ventricle. Then left border which is formed by left ventricle and left auricle. Not the atrium, the auricle, because atrium is not visible. Okay. This is about the borders. So all the borders are continuous. Superior border, right border, inferior border and left border. Now surfaces. Surfaces are anterior surface. Anterior surface is formed by the structures which is visible from the anterior aspect. That is right atrium, right auricle, right ventricle and left auricle. So these are the borders and one surface. Then another surface is left surface which is formed by the same structures forming the left border. That is left ventricle and left auricle. Left surface is formed by left auricle and left ventricle. Now the inferior or diaphragmatic surface. Inferior surface is formed by the structures which is resting over the diaphragm. While placing the heart inferiorly related to the diaphragm and the chambers which is touching the diaphragm are the 2 ventricles. So the inferior surface is formed by right and left ventricles. Now we can see the chambers of the heart. Heart presents 2 atrium, 2 ventricles. Pinna-shaped extension from the atrium are called auricle. Then regarding the grooves and sulci, atrium and ventricle are separated by atrioventricular sulcus or coronary sulcus. Two atrium are separated by interatrial septum. Two ventricles are separated by interventricular septum. So anyway, two similar chambers are completely separated by septum. But two dissimilar chambers like atrium and ventricle are separated not by the septum but by the sulcus. Atrioventricular sulcuses are otherwise called coronary sulcus. So atrioventricular sulcus are present on the right side and left side of the anterior aspect, right side, left side of the posterior aspect. But interatrial interventricular septum are present in the anterior as well as posterior surface. Now, here you can see anterior surface which is formed by the right atrium, left auricle, right and left ventricle. Inferior surface formed by left auricle, left ventricle. Apex is formed by the left ventricle. It returns towards the left and it is situated at the left fifth intercostal space. Base is formed by the left atrium and a small portion of the right atrium. Right atrium, the external features. While seeing the right atrium, this is a right upper chamber of the heart. This is a right upper chamber of the heart. It forms a superior border. It contributes the right border. It contributes the anterior surface also. So, the right upper chamber that forms a superior border, right border. Then part of the base also contributed by the right atrium. Then anterior surface. It receives the superior inferior vena cava at the upper end and lower end, and between the superior inferior vena cava there is a groove called sulcus terminalis. At the upper end of the sulcus terminalis, SA node or sinoatrial node is present, which is a pacemaker of the heart. This groove is formed by the cristae terminalis, which is a muscular ridge present in the internal aspect. So between the opening of superior vena cava, this is superior vena cava, and in the lower part you can see the inferior vena cava. This is the opening of the inferior vena cava. Here is the opening of superior vena cava. In between these two, externally, there is a sulcus called the sulcus terminalis, which is formed by the cristae terminalis, that is a thick muscular ridge present inside. You can see the internal surface with the cristae terminalis here. This is an internal aspect of the right atrium. Now, these are the external features of the right atrium. Now we are moving to the internal aspect. The internal features of the right atrium. Internally, anterior wall is rough, posterior wall is smooth. The roughness of the anterior wall is due to the presence of numerous muscular projections arising from the cristae terminalis, and these muscular projections are collectively called musculopectinate, which is arising from the cristae terminalis. You can see this is the anterior wall of the inside of right atrium. Anterior wall of right atrium is rough from inside because of the presence of numerous muscular projections. These are the muscular projections, and these muscular projections are collectively called musculopectinate, pectinate muscles, okay, which is arising from the cristae terminalis. So it has a comb-like appearance. This is the stem of the comb in which the bristles arises. So it is looking like a comb, okay, but the posterior wall is smooth. Apart from this structure, this musculopectinate, the interior of the adult right atrium consists of two rudimentary structures, and these rudimentary structures are the intervenous tubercle of lower, located at the lower end of the superior vena cava, and eustachian valve. It is formed or it is present at the upper end of the inferior vena cava. So these two rudimentary structures does not have any function in the adult heart. They are rudimentary structures, but they were functional in fetal life. In fetal life, the function of the intravenous tubercle of Lower was to direct the blood from superior vena cava into the right ventricle, and the eustachian valve, which is located at the opening of inferior vena cava, directs the blood of the inferior vena cava into the left atrium through foramen ovale, which is present in the interatrial septum of the fetus. So that concept is entirely different from the adult pattern of circulation. Fetal circulation is entirely different from the adult pattern of circulation. In fetal life, there is no functional lung in the fetus. So this exchange of materials, exchange of gas, all these are taking place through the placenta. Placenta was there, and this placenta is supplied by, or it is giving the umbilical arteries. Then fetus consists of additional structures like this eustachian valve, intravenous tubercle of Lower. Then their interatrial septum consists of an opening called the foramen ovale. All these structures are not present in the adult life. So once the baby comes out and his lungs starts functioning, just after the first cry of the baby, this foramen ovale gets closed with the force of the cry. The foramen ovale gets closed and the fetal circulation stops there, and it turns into adult pattern of circulation. This adult pattern of circulation is the normal circulation that we follow right now. That is, collecting the blood from the superior inferior vena cava to the right atrium, then from the right atrium to the right ventricle, then from there to the pulmonary trunk for the purification into the lung. From the lung it goes, or it is received by the pulmonary veins, and from the pulmonary veins the blood reaches the left atrium, from the left atrium to the left ventricle, and then through the aorta it goes to different parts of the body. That is what we have. That is adult pattern of circulation. So once the baby comes out and the baby starts crying, his lungs starts functioning and the fetal circulation changes to adult pattern of circulation, and the structures that were functional in the fetus life become functionless and they become rudimentary. Such rudimentary structures are still present in the adult heart. They are the intravenous tubercle of Lower and the eustachian valve. So in the fetal life, the function of the intravenous tubercle of Lower was to direct the blood. If suppose these are the 4 chambers, this is the superior vena cava, here comes the inferior vena cava, and just below the superior vena cava we have a tubercle-like structure called intravenous tubercle of Lower, and just above the opening of inferior vena cava there is eustachian valve. So in fetal life, this area, this interatrial septum consists of a foramina called a foramen ovale. So the function of this intravenous tubercle of Lower was to direct the SVC blood, that is superior vena caval blood, into the right ventricle directly, and this inferior vena caval blood is directed to the left atrium through the foramen ovale by the eustachian valve. So this eustachian valve is directing the inferior vena caval blood into the left atrium through the foramen ovale. This is what is happening in the fetal life. So once the fetal circulation changed to adult pattern of circulation, what happened is these functional structures, that is this intravenous tubercle of Lower and this eustachian valve, lost its function, and these structures become remnants or rudimentaries, and these rudimentary structures have no function in the adult heart, but the structure is still there. Then if you are taking the left atrium is the left upper chamber of the heart. It forms the base of the heart, the superior border. It receives 4 pulmonary veins. The blood from the left atrium goes to the left ventricle through the bicuspid valve. Internally, it is completely smooth. Almost 99% of the wall of left atrium is completely smooth. That means both anterior wall and posterior wall is smooth. Only the rough area is present in the left auricle. There are present some muscular projections called musculopectinating. Now we can see the right ventricle, external features of the right ventricle. It is a triangular chamber. It receives blood from right atrium through the tricuspid valve. It pumps the blood to the lung through the pulmonary trunk. What are the borders and structures contributed by this right ventricle? It forms the anterior surface, it forms the inferior border, it forms the inferior surface, not the inferior border, inferior surface, it forms the inferior border as well as inferior surface. Then it forms it is pumping the blood into the lung through the pulmonary trunk. So these are just some of the external features of the ventricle, right ventricle. But if you're taking the inside of the right ventricle, this white area is a tricuspid valve. This is a right atrium. Through the tricuspid valve, the blood from the right atrium reaches inside the right ventricle. If you're taking the interior of the right ventricle, it consists of a smooth upper part called, it's an outflowing part and a rough inflowing part. So there is no separation like an anterior wall, posterior wall like the atrium. Here the separation or the classification of the parts of the right ventricle internally is an outflowing part and inflowing part. Outflowing part means the area from which through which the blood from the ventricle is going out. That is the area where from the pulmonary trunk begins. Inflowing part means the area which is taking in the blood from the right atrium. So this is the inflowing part and this is outflowing part. Outflowing part is smooth, where from the pulmonary trunk begins, and this smooth outflowing part is termed as infundibulum, and this is the inflowing part which is rough. The whole inflowing part is rough. Between the inflowing part and outflowing part, this is outflowing, this is inflowing. Between this there is a crust called the supraventricular crust. Supraventricular crust. That crest is separating the inflowing part from outflowing. Then the rough inflowing part is due to the presence of numerous muscular projections. They are collectively called trabeculae carneae. So musculopectinate was the muscular projections present in the atrium, while at the same time ventricles have muscular projections. They are called trabeculae carneae. These trabeculae carneae are of different types: ridge-like, bridge-like and pillar-like. Ridge-like muscular projections, bridge-like muscular projections. Ridge means throughout the muscular projection it is attached to the surface of the wall, the surface wall of the heart. But bridge-like means like a bridge. Two ends are attached to the wall of the heart, but the middle part is free, like a bridge. Then pillar-like means they are strong muscular projections. They are otherwise called the papillary muscles. These papillary muscles or pillar-like structures are 3 in number in relation to the right ventricle, because the right ventricle consists of a tricuspid valve consisting 3 cusps. So based on the number of cusps, the number of papillary muscles are present. If the number of cusps are 2, number of papillary muscles would be 2 in number. But on the right side, we know it is the cusp of the tricuspid valve is the 3 in number. So automatically the papillary muscles are also 3 in number. And these papillary muscles are anterior papillary muscle present on the anterior wall, posterior papillary muscle present in the posterior wall, and the septal papillary muscle present in the interventricular septum. Now, here we can see the cusp of the tricuspid valve. This is one cusp. This is another cusp. This is another cusp. So 3 cusps. And these cusps are connected to the papillary muscles. So you can see the papillary muscle 1, 2, 3. 3 papillary muscles. These 3 papillary muscles are connected to the corresponding cusp of the atrioventricular valve through string-like structures. You can see some thread-like structures here, which is connecting the papillary muscle with the cusp. And these string-like structures are called chorda tendinae. Chorda tendinae. So that is another feature of the interior of right ventricle. Now, anterior papillary muscle is connected to the septal wall through a moderator band. Anterior papillary muscle is connected to the septal wall. The base of the anterior papillary muscle is connected to the septal wall. Septal wall means the interventricular septal wall through a moderator band. See the internal features. I will read on small. It has an outflowing part and inflowing part. Outflowing part is called infundibulum, which is smooth part. This area gives rise to pulmonary trunk. Inflowing part is rough due to the presence of muscular ridges called trabeculae carneae. These muscular ridges are three in number: bridges, pillars, or papillary muscles. In the interior, here, this diagram shows three papillary muscles as well as chorda tendinae and the cusp of the tricuspid valve. Pillars are three in number: anterior, posterior, septal. Each papillary muscle is attached to the tricuspid valve through string-like structures called chordae tendinae. Both inflowing and outflowing parts are separated by supraventricular crust. Left ventricle. If we are taking the left ventricle, we know left ventricle is the left lower chamber of the heart. It forms the anterior surface, it forms the inferior surface, it forms the inferior border as well as left border and the left surface also. It also forms the apex of the heart. It receives the blood from the left atrium and through the bicuspid valve and pumps into the aorta. The interior is the same like that of the right ventricle except for the following points. Interior is same in the sense it has an outflowing part and an inflowing part, but the outflowing part is smooth, inflowing part is rough. The outflowing part is called aortic vestibule, not infundibulum. That is one difference. Outflowing part is called aortic vestibule, from which the aorta arises. Supraventricular crust is there between the outflowing and inflowing parts. Inflowing part is rough due to the presence of numerous muscular projections. They are collectively called trabeculae carneae, and these trabeculae carneae are bridge-like, ridge-like and pillar-like. Pillar-like muscular projections are called papillary muscles. Here the number of papillary muscles are 2 because this chamber consists of atrioventricular valve with 2 cusps, that is bicuspid valve. So function of the papillary muscle is to connect with the bicuspid valve. If number of cusp or the number of papillary muscle is based on the number of cusp. So 2 cusps are present in the bicuspid valve, so 2 papillary muscles only present, that is anterior papillary muscle and posterior, not the septal. Then these papillary muscles are obviously connected with the cusp through string-like structures called chorda tendinae. Smooth outflowing part is the aortic vestibule. Then the wall of the left ventricle is 3 times thicker than the right ventricle, because left ventricle is the pumping area of the heart that has to pump very strongly to push the blood from the left ventricle to the aorta to reach the different parts of the body. So that much force is needed to pump the blood from left ventricle to the aorta, because this blood has to reach different parts of the body. So for that strength, it needs a thick musculature. So while comparing the musculature of the right ventricle with the left ventricle, we know the left ventricle has a thick cord of muscle which is 3 times thicker than the right one. Now this is the interatrial septum. This is the adult interatrial septum. This interatrial septum consists of a fossa, a saucer-shaped fossa called fossa ovalis, and its margin, which is very sharp, called limbus ovalis. The limbus ovalis represents the fetal foramen ovale. So this is about the interatrial septum. Thank you.